Hi everyone, Dr. David Cully here with Synergy Wellness in New York City, and I want to go over an interesting case, and I've had a few of them recently, and it's not as common. So that's sciatica without back pain, and it can be deceiving. A lot of times people don't know what's going on, and it can also throw doctors off because you walk into the office, you're complaining of foot pain, right? So, they send you to a podiatrist. Or knee pain in the back of the hamstring. They send you to physical therapy. A lot of doctors for sciatica would send you for physical therapy anyway, which is the wrong approach. And I know physical therapists are watching this getting upset. Don't get upset. Physical therapy is a study of soft tissue, okay? I'm certified in physical therapy. It's a study of soft tissue, muscle, tendon, ligament. It's not the study of nerve, disc, spine. That's what chiropractic's for. Okay, so chiropractors handle those cases. We specialize in that. We do a specialized and certified in a technique called Cox flexion distraction technique. It's the gold standard. It's a mix between decompression and it's an old osteopathic technique that an osteopath, Dr. Cox, started, but his son was a chiropractor and took it much, much further, the research and everything. Go to Cox Technique, and that's spelled COXTECHNIC.com to find a certified Cox Technique practitioner, although if they haven't recently been certified, they're not going to be on that list. So, and also just because they have the table doesn't mean they are certified. Okay, so some things to note, but we'll go over how you can tell whether or not they're certified. You want to make sure the hand starts up high. But we have Vicky here who has sciatica, no back pain. So why don't you tell us a little bit about your symptoms and what you were dealing with?
Yeah, so I have this shooting nerve pain down the right side of my foot whenever I am pulling on my hamstrings or reaching down to tie my shoe or doing certain types of lunge exercises, and it's just the shooting pain that is there. No back pain, but just on the right side of my foot.
Okay, so she had shooting pain, right? I'm going to go over some different symptoms, but that kind of signifies it's a pinched nerve. So she had probably a pretty good idea that it was a pinched nerve at that point.
Yeah, it definitely felt like something nerve related.
Yeah, now other people have different symptoms, so I want to go into that, right? Some people so sitting will make it worse. Exercise can definitely make it worse. Sleeping can make it worse. Typically walking doesn't, but it can for some people, right? Okay. So when you think about it, you're like, okay, so everything makes it worse? Not always, okay? But typically sitting and sleeping make it worse or exercise. Now, she explained how when she bent down, she would have that pain. So we'll go into that in a minute when we do the flexion distraction technique. But some other symptoms are going to be tightness in the hamstring, especially when you sit. Now think about that. When you sit, your leg, your hamstring, your knee is bent. So your hamstring is actually not pulled to its maximum tightness. So that's not a tight hamstring. Otherwise, your leg would be straight and then you would feel that, right? So when you're sitting, if you have it, that's compression on the disc, which puts compression on the sciatic nerve and creates that leg distribution pain that I'm going to give you a clearer copy that's right here. We'll put that up on the screen for you. And that shows you can see here the different leg distributions. So at L5S1, the bottom one here, it's going to, emit pain down that part of the leg and the outside of the foot where she is having lateral ankle, lateral foot pain, right? L4, L5 is a different area. It's going to be the big toe and the toe next to it, and also the lateral shin. And then you got L3, L4 disc, which could be more on the inside of the thigh, inside by the knee, right? So it can affect you in different parts of the sciatic nerve. Sciatic nerve is the biggest nerve in the body. It comes from 5 different branches from the spine. So it can affect different parts of the leg, okay? It could feel like tightness in the hamstring or back of the knee pain, or just tingling, pins and needles in the feet, tingling in the feet, things like that. So what we're doing for her is we just put her on decompression, spinal decompression. And now we're going to do some flexion distraction technique to take pressure off of that sciatic nerve. So what helps is when you do a little bit of soft tissue work here around the lower back from, like T12 down. And what that does is it helps to loosen up the joint capsules, the spine, the disc. And when you loosen up the joint capsule, and then you go in to do flexion distraction technique, it's just going to be that much more effective. And she's going to be sore in these areas. So there'll be trigger points, and definitely on the right side, that's where she's having the sciatic nerve pain. And again, no back pain here. You do not have to have back pain to have sciatica, although most people do. And do you feel that right in there?
Yeah.
Okay. And there?
Yeah.
Okay. And there?
Yeah.
And there? Okay. Now we're going to ask you 1 to 5 scale. How tender is that?
That one's okay. That one's maybe a 2. That's a 4.
4, okay.
That one's a 2.
2,
And that one's probably 3.
okay.
That one's a 4.
Okay.
Oh,
That's a 4.
4, yeah.
Okay. All right, so she's got some 4s and 3s in there. Now we're going to go ahead and do cold laser therapy for her sciatic nerve because that inhibits the nerve. It also reduces all the inflammation around the sciatic nerve. It's really great with flexion distraction technique and spinal decompression. So now that we have a cold laser set up, and there's a lot of people that ask me questions about cold laser therapy. I've done videos on that. This video is not about cold laser therapy. Please check out those videos. We even have a whole playlist of videos for cold laser therapy, recommendations, what to avoid, how laser works, all of that. But this is specifically about sciatica without back pain. Now, how long have you been dealing with this for, on and off?
Maybe close to a year now.
A year, okay. And what have you done for it so far? I think physical therapy, right?
Yeah, I tried physical therapy. It didn't do much.
Yeah, and then I go back to that.
I
Sorry,
thought
go ahead.
maybe, I just thought maybe I just needed to do more strength training overall. That I think made it worse.
Well, so it's a great comment, right? So she said the PT didn't help. Again, I go back to PT's the study of soft tissue muscles, and there is a place for that in sciatica. Absolutely, but she just put the cart before the horse. So she had sciatic nerve pain, there was pressure on the sciatic nerve. Chiropractors take the pressure off the nerve, decompress the disc, then you go into PT. So we have physical therapy here at Synergy Wellness. We take pressure off the nerve, then we start the PT so it doesn't get aggravated. And in the process, if it does, then they just come right across the hall here and have either decompression or a spinal adjustment, either with Cox technique or another technique. But the mixture of the two, but the chiropractic first to take pressure off the nerve, heal the disc, and then start physical therapy after that. So I hope that helps a lot of you folks out there that are watching this. Now we're going to do the Cox flexion distraction technique next. So stay tubed for that, okay? We're going to start that in just a minute. So when lasering for sciatica, we want to start at the nerve roots and then work our way down the sciatic nerve pathway. So we go into the piriformis, which we just did, and we did the spine, of course, and then we go right here at the bottom of the glute, where the glute and the hamstring meet, and some of you have experienced tightness or pain or discomfort right back here. It's very common. This laser is powerful, so we can get this up to 200 watts, even 50 watts. It's adjustable, even 25 watt. But so treatment times can be a little bit quicker. Don't compare this laser to another practitioner's laser. They're all different in a number of ways. So that being said, we want to follow the pathway of the sciatic nerve. So we're going to go at this point, the second point is going to be right in the middle of the hamstring, just in the middle between the butt fold and the fold of the knee, right here. So we can do about a minute in each spot. And then, and again, we did flexion distraction. We're going to do that afterwards. That's what we finish up with. That's the chiropractic adjustment. It's just a different, gentle adjustment. And if you've never seen Cox flexion distraction, or you're not sure what it's for disc herniations, disc bulges, spinal stenosis, pre and post-surgical cases, pinched nerves, and more. But those are the main things that Cox technique focuses on with the spine, okay? And it's only a spinal adjustment. It's not meant to do anything else, adjust any other part of your body, even though we strap you in at the legs, okay? That being said, it is the gold standard for treatment of disc herniations, bulges, or stenosis, pre or post-surgical, without drugs, medications, injections, okay? And we save a lot of people from doing that, from going that route. And injections are considered surgical, although it's minimal surgery compared to, you know, a laminectomy or a discectomy. And about 2% of people with sciatica require surgery, meaning require injections or spinal surgery, even worse. And the outcomes are not good, okay? And remember, spinal injections are temporary relief. Once you have a disc herniation with spinal stenosis, that's it. That's a permanent injury. But you can have a disc bulge, and that's not a permanent injury. That can reverse itself over time. And then there's people with degenerative discs where they're dried out over time, age, and that happens pretty frequently. That's common for that to happen. So, you know, as we age, those discs dehydrate. So what we're gonna do with the flexion distraction technique is open up and rehydrate those discs. It's helpful to not only rehydrate the disc, but to open up the back of the disc where the nerve exits from the spine, taking pressure off of course, in this case, the sciatic nerve. But you can use flexion distraction technique for a pinched nerve in the neck radiating down your arm, okay? That's a different side of the table, obviously, and the head and the neck piece lowers, just like you'll see the lower half of Vicky's body here. So we're going to do a minute again on each side. And then after we do like about an inch above the knee, we're going to go ahead and do the middle of the calf, because she has it all the way down into her ankle. So I want to travel the entire pathway of that sciatic nerve and shut it down, reduce all the inflammation, inhibit the nerve. That's what I mean by shutting it down, right? The frequencies I'm using on this laser are inhibitory, right? We don't want to excite the nerve, and we can do that with the laser, but we don't want to do that. So when you use the wrong frequencies on the laser, that can create some problems for the patient, obviously. So you need to know how to use these lasers. They're selling them all over Amazon. Be wary, be careful about that, okay, folks? Those are not the same lasers you're finding here in the clinical office, okay? So do you feel anything, Vicky? Do you feel anything while I'm doing the laser?
No.
Yeah, you won't feel anything. Doesn't burn, doesn't hurt. It's not like a laser hair removal or laser tattoo removal, nothing like that. And we've got 30 more seconds here on the calf, and then we're gonna go ahead and strap her in now and do the flexion distraction, Cox flexion distraction technique. We've already done it on her before, so there's a matter of tolerance testing the patient. We're not gonna go through that because we've already done that with her, but there's stages in this technique that it's important that the practitioner follows. And if at any time you have pain radiating down into your leg increasing while this technique is being done, you need to step back a stage or two, right? And we've had that happen once, maybe twice in my 25-year career, but people have setbacks from time to time, so here we go. We're going to begin the flexion distraction technique. I'm going to go ahead and unlock this table down here. We want to make sure there's a high hand placement. She complained that she had some chest pain once, so we're going to just start up really high above the chest at the top of the neck. Place light hand placement on the spine. And we go down segment by segment. And, you know, it doesn't look like much. I'm going to go on the other side so you guys can see. It doesn't look like much. But how does that feel to you, Vicky? I mean, especially when I put my hand down lower, how does it feel?
No, it feels good. It feels fine.
Like a deep back stretch?
Yeah.
Yeah, like a deep back stretch. And you really want a gentle technique, especially when you're dealing with a disc herniation or a disc bulge, which is most likely putting pressure on that sciatic nerve. You want to be gentle. And this is a really great, gentle technique that can be used on everybody. And that's why it's the gold standard to treating disc herniations and disc bulges. And then, after the pain has been reduced, swelling on that sciatic nerve and it's starting to heal up, and that could take anywhere from 6 to 10, even worse cases 12 weeks. So, you know, some cases even less than 4 weeks. You know, it just depends, but depends on how long you've had it, depends on the type of herniation versus bulge. There's so many different factors, how many levels, the condition of the patient, so many factors, but it could be anywhere, I guess, from 4 to 12 weeks usually. But in 4 weeks, with this technique, you should see at least a 50% improvement. So if we don't get 50% improvement in 4 to 5 weeks max, we actually refer the patient out either for imaging, MRI imaging, typically, or we do an EMG. We have a needle EMG here, so we do nerve testing here as well, and or a referral out, okay? But oftentimes people get more than 50% improvement in 4 weeks, but that's a minimum of what we're looking at. And we're gonna loosen up the muscles here on the side of her spine and then go ahead and do some more flexion distraction technique. But you've seen the basics, and if you guys have any questions or comments, feel free to comment below. If you have sciatic or leg pain without back pain, you should have that checked out by a chiropractor first, and then do the PT after you've healed up a bit and you're feeling much better. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.